Did you know that nearly half of all massage therapy clients, about 49%, are looking for relief from soreness, spasms, and stiffness? Another 42% are fighting chronic pain, and 36% are recovering from injuries. While the therapy side is booming, the billing side can be an absolute headache. If you want to accept insurance, get paid faster, and avoid denied claims, you have to master CPT codes. Today we're breaking down some of the most common codes and the step-by-step billing process so you can get paid what you're worth. First things first, what are CPT codes? They're standardized medical codes maintained by the American Medical Association to make sure healthcare providers and insurance companies speak the same language. For massage therapy, your treatments usually fall under physical medicine and rehabilitation. Here are four main codes you'll see daily. CPT code 97124, therapeutic massage. CPT code 97140, manual therapy techniques. CPT code 97112, neuromuscular reeducation. CPT code 97010, hot or cold packs. Quick note, do not use 97124 and 97140 interchangeably. If you use them in the same session, you must use modifier 59 to prove to the insurance company that you treated different areas or used distinct methods. Without that modifier, they'll likely deny the claim. Let's talk about time tracking because this is where a lot of therapists get tripped up. Most massage CPT codes are timed codes billed in 15-minute blocks. But you don't have to actually hit 15 minutes to bill a unit. You just have to meet the 8-minute rule. To bill insurance for a single unit of a timed service, you must perform that specific therapy for at least 8 minutes. Never ever guess or round your times. Estimating is the fastest way to trigger an insurance audit or an immediate claim denial. In your notes, always write down your exact start and stop times, the total duration, and exactly what you did during that specific window. So how does the whole process look from start to finish? It breaks down into 4 essential steps. Number 1, credentialing and setup. Before you see a single insurance client, you need your active license, an NPI number, an EIN, and liability insurance. You'll partner with insurance payers to set your reimbursement rates. Pro tip, set up your billing software and get a clearinghouse account immediately to submit claims digitally. It's the ultimate hack for getting paid faster. 2, pre-appointment checks. Before the hands-on work begins, verify the client's insurance eligibility and check if they need prior authorization. Most importantly, ensure that they have a physician's prescription that proves medical necessity. 3, treatment and documentation. Align your treatment exactly with the prescribed CPT code. Use SOAP notes to document everything. You need to clearly show that the patient has a functional limitation, like shoulder pain or restricted knee mobility, that your massage is actively treating. 4, submission. Code the claim, send it off through your clearinghouse, wait for the payer to accept or reject it, then collect on your reimbursement or bill your client. The most successful massage practices don't just provide great body work, they build consistent billing workflows. Avoid rookie mistakes. Don't round your time, don't use outdated codes, and never forget your modifiers. If you'd like to learn more about CPT codes, reach out to Etactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.